Hey guys, how you going? Thanks for joining. Just get myself sorted out here. All right, I'm pretty sure you can see my slides there. Rightio, we've ticked over to 10:01, at least in my part of the world. So let's make a start. Guys, we're going to be talking about sweaty feet today. So we're going to cover, obviously, the relevance to blister formation. That's why we're here. We'll have a quick look at sweat gland anatomy and physiology. We'll have a look at normal sweat secretion, regional differences, the disorder of hyperhidrosis, and some management strategies and treatments. What's the relevance to blister formation? Well, quite simply, I think we all know this, that even mild to moderate hydration levels of the feet are known to increase skin friction and the likelihood of blisters. And this is just a snapshot of research and papers that support that. One that I'll draw your attention to is, if you were on last week's call, we looked at the Hashmi study where they produced blisters on the posterior heel. Well, the same set of researchers kind of replicated that study, but this time they had 1 foot in a bucket of water and 1 foot not, and they did the same load to the posterior heels, and they found that the rate of temperature change in response to that repeated shear loading was significantly greater on the hydrated skin compared to dry skin. And they found that if you, temperature increased with repeated shear load, and it could be used to indicate imminent blister formation. So this indicates that the wetter the skin is compared to dry, the sooner you'll get blisters with the same amount of shear load. In terms of mechanics, where does friction come in? Well, essentially, friction is the force that exists between the interfaces or the materials external to the skin surface. So we're talking skin, sock, and sock shoe. So if friction level is high there, friction force is high there, then it keeps everything stuck together while the bones are moving back and forth in the foot as part of normal motion or normal mechanics. So the bones are moving back and forth, skin's staying still, and all the soft tissues in between allow that to happen by undergoing shear deformation. So if those friction levels are high, the skin stays still for longer. So given that the bone has to move the same amount or a certain amount each way, the magnitude of shear deformation is going to be larger when that friction force is large. But if we can reduce that friction force, then as that bone moves the exact same amount, which is required for whatever activity that's happening, then the skin is able to move in sync with the bone at an earlier moment in that individual shear distortion, and that thereby reduces the magnitude of that shear distortion. So when our feet sweat, it increases skin friction by increasing the coefficient of friction. Anatomy and physiology, we'll just have a quick look. These are the two references that I've used to get this information. Very quickly, the sweat glands that don't matter to the feet are the Eccrine, which is the second from left, the one that empties into the hair follicle in the middle. So they are basically, they don't start working until puberty, and they're not on the feet. Apoecrine, which is the far right, that is a modified eccrine gland. They're mainly in the axilla. They kick into gear around 8 to 14 years of age. Again, not on the feet. Any talk about sweat generally involves a quick discussion of sebaceous glands. They're not a sweat gland, but they distribute matter onto the surface of the skin. So if you're looking at sweat on the skin, you're also looking at sebum. But the one that we're worried about in terms of feet is the eccrine sweat glands. So equine sweat glands are on glabrous, which is non-hairy skin, i.e. the plantar surface, and also on non-glabrous skin, that is hairy skin, like the dorsum of the foot. Across the body, they're the most numerous. They have the highest densities on the palms and the soles. They're responsible for the highest volume of bodily sweat. They kick in around 2 to 3 years of age. The total number is fixed. So as we get older and grow bigger, we don't get more sweat glands. We just have the same amount. They just get distributed over a larger area. So you can say their density decreases. They receive sympathetic innervation and they respond to thermal and psychological stimuli. If we have a real quick look at the sweat gland cells, they can be basically divided into the duct, which is the straight bit that takes the sweat to the surface of the skin, and the secretory coil, which is like the big ball of wool at the bottom. The bits that I've circled in blue are the duct cells. Their primary function is the reabsorption of sodium and chloride as the sweat passes up towards the skin, such that the sweat that is finally distributed to the skin is hypertonic. And if we look at the secretory coil cells, there's 3 types of cells there. There's clear cells, they're the ones that actually produce the sweat. There's dark cells, we don't really know what they do, and myoepithelial cells. So the clue is in the name there. They have a contractile function, so you'll find these types of cells anywhere that has anything to do with secretion. Equine sweat glands primarily respond to thermal stimuli, particularly increased body core temperature, but also skin temperature, and increased skin blood flow also plays a role. So it's basically thermoregulation. Thermal sweating is mediated predominantly by sympathetic cholinergic stimulation. So we've got this green sympathetic postganglionic neuron. It gets to the clear cells. These are clear cells that produce the sweat. It releases acetylcholine, and that binds to the muscarinic receptor on the clear cell. So it's the release of the acetylcholine that kickstarts sweat production. Equine glands also secrete sweat in response to adrenergic stimulation, but to a much lesser extent. So that's basically the fright or flight mode. In addition, equine sweat glands respond to non-thermal stimuli related to exercise. So this is in reference to the fact that we know that people that are fit and exercise a lot, they sweat more and sooner than people that don't exercise a lot. So you could say that their thermoregulation is more effective. So a quick summary so far. Sweating is mainly for thermoregulation, but it's also relevant to the fright or flight mode, and also non-thermal stimuli relating to exercise. So the dorsum of the foot has a much lower gland density than the plantar surface, and it's primarily responsible for thermoregulation. The plantar surface has a much higher gland density, and it responds to emotional as well as thermal stimuli. So if you had to say right now which one sweats more, the dorsal surface or the plantar surface, which would you say?
Plantar.
Me too. And you might get a shock soon. How much do the feet sweat? Carlson mentioned a quick pilot study that they did in Marty Carlson's paper from 2006, which is definitely worth a read. They got fresh socks from 3 runners, and the moisture content was 15, 23, and 31%. So he suggested that we should be, if we're interested in what's going on in the shoe, we should be looking at a moisture content of the sock of about 25 to 30%. The graph on the right is where they got a cotton sock and they gradually increased the water content from 0 to 100%. And you can see the differences in the coefficient of friction on the y-axis here. So 25 or 30% is this line here. But if we just look at what happens as the sock gets wetter, now this is a cotton sock, PTFE, which is the engo patches or shear band, that remains relatively constant no matter how wet the sock gets, about 0.2 coefficient of friction. The yellow one, which is poron, increases sharply to about that 25–30% mark. Then it levels off, and then it increases again at around about 70%. Plastozote is relatively stable from around 0.45 to 0.5 coefficient of friction, and Spenco increases for the first half and then kind of levels off for the second half. Now, we know that Spenco has a good blister prevention effect. That research has been done in terms of blisters and calluses, so it is effective. So from this data, you would probably question whether its main mechanism is coefficient of friction reduction. Probably not. I wouldn't think so. I would think it's more likely to be something else, and my best guess would be shear absorption and maybe even pressure management. How much do the feet sweat? Different values are mentioned. The first two here are from these two studies. So this is from 2006, 2007. And then a subsequent paper that was similar to these two papers that I will talk about in a minute, they give us these values. So, I mean, yeah. Regional differences. So these two papers, 2006, 2007, from what I understand, are the first two that really look closely at regional differences on the feet. Both of them find that the dorsal aspect sweats a lot more than the plantar aspect, around about 70 to 30. Taylor, Nigel Taylor's from the University of Wollongong, and him and his team have done a lot of work in this area, published a lot of data. And the Fogarty is a UK study. Wow. And let's have a look at some pictures from the Taylor study. I apologise for the images, but this is really all we've got access to. So they have these sweat capsules, and it's kind of hard to understand how they work. I really don't understand it myself, so I'm not going to try and describe it. But essentially, we've got 3 dorsal areas. They call this one an outer, which is sort of more like a dorsolateral, and then 1 capsule on the plantar surface. I would have thought, let's put more on the plantar surface because I would have expected more sweat there, so I'd be more interested in that. But anyway, let's have a look at what they actually found. Now, the heating mechanism here was cycling. So what they did was that both feet were nude, so they were uncovered. One foot was doing the cycling, and the other one had all these capsules on it for measurement. So the regional differences. The top graph is the average across the whole trial, whereas the bottom one is the last 15 minutes, I think it was. Either way, they're kind of similar. So the dark black one, the first one, which is the biggest, that's the forehead. So first things first, we can tell that the feet sweat less than the forehead. Second thing that is interesting is these last 2 little ones. That's the sole, the plantar aspect. That's from the capsule that was on the plantar aspect of the foot. And these others were the dorsal and then the dorsolateral. So there you go. Now, I was keen to just see if there was more information. So I find it hard to believe that the plantar surface doesn't sweat more than the dorsal surface. So if you read more research, we've got this combined paper. So the one on the right with the same capsules from Nigel Taylor and his crew at University of Wollongong, and you can see that they had more areas that they were gathering sweat rates from. So that was good. There was more information. And the one on the left was from the UK, and they used absorbent patches that stuck to the skin, and you can see that it covers kind of about 90% of the foot. And the idea was that they wanted to pool the data. So although there were different methods, they wanted to just increase the subject pool, like the number of subjects, to make this more meaningful. So they sort of designed their research so that they could pool the data. So the one on the left was absorbent patches, and they were running at different intensities, and the one on the right, there was 2 heating mechanisms. One was they were at rest and they wore what I kind of assumed to be like a wetsuit, where they pump hot water into it to heat the skin. And then after they did that, they then cycled. So that one-legged cycling thing again. So the differences to note here, the one on the left, they had shoes on, and the one on the right was bare feet. The absorbent patches, so this is the UK. Sorry? Oh, sorry, Erica. You got your mic on.
Oh, sorry.
No worries. The one on the left here is men. This is women. It looks pretty similar, but what you need to realise is this y-axis for men is 1.2 and the y-axis for women is 0.6. So essentially that tells us that women sweat half the amount of males at the same work rate. And for the sweat capsules, what we can see here is the 2 plantar aspects. So the plantar toe and the sole of the foot, these are the lowest. And the dorsal toe and the dorsal foot are the 2 highest here and 2 highest here, and then the lateral and medial. And in this one, it's turned around, medial and lateral. So this was the second study using the capsules. This was the passive heating, where they just had that wetsuit on that they put the hot water in, and this was the cycling, the one-legged cycling. The results from both labs were in agreement. The feet sweat less than the forehead. Males secrete more than twice the volume of sweat as females at the same relative work rate. Their highest local sweat rates were observed from the medial ankles. This one back here. So medial ankles is the biggest here. And then dorsal foot, lateral ankle, dorsal foot, lateral ankles. So these are kind of similar, but definitely with women, it was more uniform. The dorsal foot sweated substantially more than the plantar areas. Both genders demonstrated a non-uniform sweat distribution, though it was less variable in females. And sweating on the plantar side of the foot was actually quite uniform. One interesting thing that they mentioned was the trials that were wearing shoes. So that was the absorbent patches where they were running on a treadmill. They sweated less, basically, as workload increased. So wearing shoes limited the increase in sweat production, while the sweat rate of uncovered feet kept increasing with work and thermal load. So the bare feet, if you made them hotter and increase the work, then they would just keep sweating more and more and more. And when the people in the shoes, they would sweat more with work and thermal load, and then it would level off. And if you kept increasing the thermal load and the workload, it was still leveled off. And this is what they call hydromyosis. And it is essentially the skin swells due to the excessive hydration, and that closes off the sweat ducts and blocks sweat secretion. This is a different study. 14 females performed low intensity running with nude feet and at low and high intensity running with shoes. Foot sweat rates were measured at 14 regions using the absorbent patches. And what they found was the bare feet sweated 22% more. And those that were in shoes, it did not increase with exercise intensity. So that's that hydromyosis. High sweat rates were observed at the medial ankle and dorsal regions. So we've got the same info here. Lowest sweat rates were at the toes. And interestingly, the perceptions of wetness and foot discomfort did not correspond with regions of high sweat production or low skin temperature. You would think that low skin temperature would correlate with high sweat production, because the more it evaporates, the cooler the skin is, but rather seemed to be dominated by tactile interactions caused by the foot movement within the shoe. So it's like you feel more with the plantar surface than you do with the dorsal surface. So even though the dorsal surface is sweating more, you just feel it more on the plantar surface. Another study This one was not exerting a thermal load to the skin. It was a psychological mechanism of sweating. So subjects perform mental arithmetic in a temperature controlled room with psychological sweating evaluated from 9 sites, and they used the ventilated capsules. Sweating was evident from 3 glabrous sites. Glabrous means not hairy, so the plantar surface or the palmar surface. However, significant sweating was evident from 2 non-glabrous or hairy surfaces. So there is thought that the plantar surface is the area that sweats when there is psychological load. So psychological sweating from the plantar surface and the palmar surface, but not the other surfaces. But this suggests that it's actually both. These observations further refute the proposition that psychological sweating in humans is restricted to glabrous, i.e. plantar and palmar skin surfaces. So the dorsum has a lower gland density, but it sweats more than the plantar surface. The plantar surface has a higher gland density and it sweats less than the dorsal surface. Who knew? Eccrine sweat glands. One interesting thing that was mentioned was that most of the variability in regional and whole body sweating rates within and between individuals is due to differences in sweat secretion rate per gland rather than the total number of active sweat glands. So that kind of makes sense because we've got high density sweat glands on the plantar surface, and yet that's not the part that sweats more. Okay, let's move on to hyperhidrosis. Hyperhidrosis is a disorder of excessive sweating for no good reason. So it's not people that sweat a lot when they exercise, and it's not people that sweat a lot when they're stressed out. It's people that just in a resting state with no thermal or psychological stimuli, they sweat profusely. That's what hyperhidrosis is. So it's a disorder of excessive sweating beyond what the body uses for homeostatic temperature regulation. It's due to the overstimulation of cholinergic receptors on eccrine sweat glands. So where this green nerve comes and releases the acetylcholine. So it's an overstimulation here. The acetylcholine negative feedback loop is likely impaired. And interestingly, eccrine sweat glands appear normal in size and number, but the sympathetic ganglia are usually larger in people with hyperhidrosis. Hyperhidrosis can be classified as either primary or secondary. So primary presents earlier in life. The etiology remains unknown, and genetic factors are thought to be involved, but it's not that well understood. Secondary hyperhidrosis is usually the effect of medications or systemic disorders. A few interesting facts about hyperhidrosis. It's estimated that 3% of the US population suffers with this disorder. It affects all races, but highest incidence is in the Japanese. Developing segmental or localized hyperhidrosis is relatively rare, and the rare cases of unilateral hyperhidrosis tends to be more common on the right side of the face or arm, with anhidrosis on the left side. I thought that was interesting. Treatment. Okay. Well, not really treatment, but really just moisture management. We can obviously use socks for moisture management. Moisture wicking obviously makes intuitive sense. So if there is a moisture wicking function, it takes the moisture away from the skin surface so it can be evacuated into the shoe environment and then through to the shoe into the atmosphere. Which moisture wicking sock works best? Who knows? Does moisture wicking work better than like a wool sock? Who knows? We don't know. The research isn't there. Merino wool is used in a lot of socks. It tends to be quite popular. We know that wool has the ability to absorb moisture within the fibre, which moisture wicking acrylic fibres don't, or synthetic fibres don't. Toe socks obviously give us a moisture management strategy at the interdigital space where normally there is none. So normally it's a skin-on-skin interface, but now we turn it into, we put 2 sock layers in there. We know that thick socks work better than thin socks. We know this from the Herring and Ritchie studies from the early 1990s. So what happened there was they had 2 identically constructed socks, both thin. One was 100% cotton, one was 100% acrylic. Neither of them was better than the other in terms of blister prevention. Then they repeated it, but this time they were identically constructed with a dense padding sort of a construction technique. So they were thicker, essentially. And it found that the 100% acrylic sock was way better than the 100% cotton sock. So it was a thickness that mattered most in terms of blister protection. Now, we could assume that that was because of a moisture management function, but who knows? It could have been something else related to its thickness. So it could have been a pressure reduction strategy, or it could have been via a shear absorption mechanism. But either way, we kind of know that thick socks work better than thin. And of course, change out of wet socks, even just once in the middle of the day, can help a lot in managing moisture. Ventilated shoe uppers, obviously much better than Gore-Tex. Astringents, they decrease sweating by denaturing keratin, occluding the pores of the sweat glands. Unfortunately, the effect is very short-lived. Aluminium chloride, hexahydrate, 20%, for example, dry claw. It's over the counter. I had a quick look online this morning, and you can buy it on Amazon and eBay, but I couldn't find it in any of the major online pharmacies. So I don't know really what the go is there, but it's available. The idea is you use it 3 or 4 nights in a row and then nightly as needed. Skin irritation can occur and patients often become intolerant of it in the long term. Iontophoresis. This is where you have this kind of a setup. You put a bit of water in the tap water on these pads. You stand on them. They plug into the wall and they put electric current through the water. It doesn't hurt. I think it's just like a bit of a tingle. The mechanism, it's actually not that well understood. Compliance is relatively low with this. It costs a little bit to set up, but I think all the gear sort of lasts a long time. I know of a couple of people that have used this, and one finds that it works really well. It's a bit of an ordeal. Like, it's not a just treat it once or every day for a week or a month and then you're done. It's sort of, you go intensely for a little while and then you sort of spread out the treatments over time. So maybe worth a go. Oral anticholinergic medications. The picture on the right isn't an oral, but it uses the same ingredient as one of the orals, the glycopyrrolate. This is a cloth, so it's a damp cloth that is usually used for the underarms. It's relatively new. I'm not sure if you can get it in Australia, but it's definitely in the US. It's on prescription. Botox injections. I don't know of anyone that's had this done on their feet, but apparently it can be done. Obviously in a similar setup like this. And the decreased perspiration can last from 6 to 24 months. So that's pretty decent. Essentially, it's prevents the binding presynaptic fusion of the acetylcholine vesicles with the nerve terminus, and thus it blocks the release of acetylcholine. So if we block the release of acetylcholine, the clear cell just can't produce the sweat. And lastly, sympathectomy and local excision, which would be done even less than Botox. The consensus is that no treatment works reliably and recurrence is common, and all the topicals, which obviously is the easiest things to advise our patients on, can cause skin sensitization, and some can discolor the skin, like the potassium permanganate. So that basically wraps it up. We're 10:30 exactly. We've covered the sweaty feet, perspiration, why it occurs, how it occurs, relevance to blister formation, regional differences. I hope you got something out of that, and hyperhidrosis management and treatments. So basically, we're not going to have time for Q&A. We got some really good questions over the week. Only one of them was related to sweating, which was Hafsa asked, what's the best to reduce sweating in the feet without using potassium permanganate solution? Well, Hafsa, I don't really know if we know. There are other options. They don't have great, you know, like long-term success. I don't know of any study that's kind of compared potassium permanganate with another. But yeah, there's a few modalities that you can think about in talking to your patients. So I'm definitely going to stick around for questions if you've bothered to be live on the chat. So I'll just open the chat box now and see what we've got. So type it in, or if you've got a question, just turn your mic on if you like. No questions?
Hi, this is Nick.
Hey, Nick, how you going?
I'm good, yeah. I've never actually used potassium permanganate, and I just wondered, like, how effective that actually is. And I know it's used a lot in the past, and if people are still using it now.
Mm-hmm. Well, I mean, it can definitely work. This is how it works. It denatures keratin and occludes the pores. So effectively, sweat is produced, but it doesn't get out onto the skin. How effective is it? Well, it's short-lived. So
Yeah.
and none of these topicals can really be expected to work that well, especially in someone who is exercising or someone with hyperhidrosis. But it's something that can work in the short term.
Yeah, and things like the skull, the actual sprays. Do you think they're any good? Those ones?
What ones?
The Dr. Skull. I think it's a little can of spray.
No, I wouldn't think so. The
Yeah.
research on antiperspirants has found that very strong antiperspirants can work as a blister prevention, but they have a side effect of a high proportion of skin irritation. That's why they can't really be used. So this was done in military populations. When they added emollients to those preparations to try and reduce the degree of skin irritation, the blister prevention effect was lost. So
yeah.
I wouldn't think there's any spray, be it antiperspirant or astringent, is going to work that well.
But the aluminium one that you pointed out, dry something, are there other products that have got that dry claw? Are there other aluminium chloride products you can buy over the counter other than that one?
I don't really know. But
Okay.
yeah, good question for the pharmacist. But I think that basically the research shows that there's no antiperspirant that doesn't annoy the skin that works as a blister prevention or reduces sweating significantly.
Yeah. Okay, that's great. Thanks for that.
No worries. But I guess it's give your patient the options and they can have a test for themselves because everyone's different. You never know what might happen. Thanks, Nick.
Great. Thanks very much.
No worries. Bye. Thank you. Any other questions? Well, next month we'll just have a Q&A. So if you do have a question, feel free to, when you register, just ask because we do have some really good ones that I want to go through. So with that, if that's all, I will bid you farewell and I'll see you first Wednesday of next month. Thanks, guys. See you.
Thanks, Rebecca.
No worries. Thanks, Erica. Cheers, Sophia.